Do you measure your blood pressure correctly? Because many people do it wrong. Blood pressure is one of the most common health checks in the world, but here's the problem if it's not taken correctly. The numbers can be completely misleading. A small mistake like talking, sitting the wrong way, or using the wrong cuff size can make your blood pressure look higher or lower than it really is. And that matters because those numbers are often used to decide whether someone needs medication or further tests. The tricky part is that high blood pressure usually has no symptom. Most people feel perfectly fine, so the blood pressure reading itself is often the only warning sign. If that reading is wrong, real problems can be missed or created. In this video, we will demonstrate how to correctly take your blood pressure. First, sit correctly, make sure you're seated in a chair with your back supported and feet flat on the floor, not crossed. Rest your arm on the table so that the cuff is at roughly heart level, so mid-chest. This position helps ensure the reading isn't falsely high or low. Also ensure you're in a quiet, relaxed setting and that you use an appropriate cuff size. Next step is to relax. Don't rush and immediately take a reading. Make sure you sit and relax for about 5 minutes before measuring the blood pressure. Avoid exercise, smoking, or caffeine for at least 30 minutes prior to measurement, as all of these can temporarily raise your blood pressure. Make sure to use the right cuff and device. Ensure you have a validated blood pressure monitor. The cuff should be the correct size for your arm, as a too small cuff can artificially raise the reading. Wrap it on bare skin, not over clothing, on your upper arm, about 1 inch above the elbow crease. It should be snug but not painfully tight. You should be able to fit a fingertip under it. Automated blood pressure monitors are often used, but if you have a heartbeat that's irregular, like in atrial fibrillation, guidelines suggest you use a manual measurement, as irregular pulses can sometimes fool automatic devices. During the measurement, rest your arm comfortably on the table, palm up, with the cuff at heart level. Now, remain quiet and still. Don't talk or even look at your phone. Talking can significantly raise the reading. Breathe normally and don't clench your fist or tense up. The machine will inflate the cuff, then slowly deflate it to measure your blood pressure. It only takes about half a minute. If you're taking your blood pressure for the first time, make sure to measure both arms first. Compare the readings and use the arm that gives you consistently the highest reading. If there's no consistent difference between the arms, then go for your left arm because it's a bit closer to your heart and maybe more representative of your heart function. If the difference is more than 10 millimeters of mercury, then this could suggest a blockage arising from atherosclerosis, the artery clogging disease process at the root of most heart attacks, strokes, peripheral artery disease, and other cardiovascular conditions. So make sure to mention this to your doctor if you find this. Take multiple readings. So take at least 2 readings, 1 minute apart. Often the first reading is a bit higher and the second will be more accurate as you settle down. If the first 2 differ a lot, take a 3rd reading and use the average of the last 2 readings. At home, doctors often suggest measuring morning and evening blood pressure for several days. Write them down in your notebook so you can share it with your doctor. In our demonstration, notice the volunteer is sitting quietly with support, not chatting or scrolling on the phone. We've waited for a few minutes after they sat down. The cuff is placed on the bare upper arm with the correct size and it's snug. And only then we start the device. By following these steps, we ensure the numbers actually reflect your true blood pressure and it isn't thrown off by external factors or bad technique. Remember, proper technique equals trustworthy numbers. If you like this video, give us a like, share and subscribe. And if you want to know why blood pressure matters, check out one of our previous videos from Doc Dialogue.